Welcome everyone to Aspiring Mentors webinar session. On our today's webinar, we'll be discussing on how to ace your Step 1 USMLE Step 1 exam. Our today's presenter is Dr. Kumar. Dr. Kumar is an international medical graduate who successfully passed his USMLE exams, and he's also a mentor at Aspiring Mentors. If you have any questions, please write them down in the chat section. We'll be having question and answer sessions at the end of the presentation. So welcome, Dr. Kumar.
Thank you for inviting me. Hello, everyone. Good morning. My name is Kumar. I am from Pakistan. So when I took my step 1, it was really race against the score rather than just to get a pass or fail. So I will try to answer your all questions during this session. So without wasting any time, we can begin our presentation. And meanwhile, if anyone has any question, they can write in the chat box or directly forwarding to the aspiring mentors, the main host of this webinar. This webinar will be overview. What is step 1? What are the components? Who can take the exam? What are the best resources available currently, which we can use to ace the exam? And the timeline and how to start preparation. So overview, what is actually USMLE step 1? So basically this step 1 exam is mastering your basic medical concepts and then how you will be applying into your medical practice. That's what this basically the exam is. So the boards are looking for, let's say, if any basic concept is heart failure, what are the parameters of the heart failure leading to edema? So these are the some basic type of concept you should remember to answer those type of the questions. That's a pure basic knowledge, so you don't need to have a, well, I can say made and like complicated or complicated thoughts for that. What will be the treatment or no, just remember the basic pathophysiology of the disease and the process. Now who can take step 1? So currently the one who are US medical students or Canadian, they can take it, or the one whose medical school is listed in World Directory. That's those people who are eligible, they can take it. There is a change worldwide, like in Pakistan, their PMC is being registered to this, and now they will be eligible after 2024. And there is some changes in India as well, so these are the changes which has been occurred. So before you even start preparing, make sure that you are eligible to register with the ECFMG. That's the main step. You need to register with the ECFMG first to take your step 1 exam. And then what is the step 1 test comprised of? So the exam is for 8 hours with 7 blocks. Each block lasts for 60 minutes. In each block you have 40 questions. That is total, you have around 280 questions. Out of that 8 hours, you will be given 15-minute tutorial, and there will be 45 minutes of break time. Now this break time can be used as you want. Like you can take around half an hour break with a block. You can take around 5 minutes, 10 minutes. So every time you leave the exam hall, and then every time you come back, you will be they will do a recheck. They will scan you for anything. So there's sometimes people try to use it after every 2 blocks. So that's another session we can cover what to do during the exam. Okay, now next is when to take the exam. So step 1 is administered year round. So you can take at any time you want. But the wise thing is try to take it before the pool changes, or after the pool has changed. Try to wait for 2 months, so that there are many experimental questions in the exam. So that's the best time, I will say. Try to take it after 2 to 3 months of the pool and before the pool. That's the best time to take the exam. But of course, if you are ready enough, you can think that I can take the exam. So you can take the exam whenever you want, actually. And the total cost for the exam for USMLE Step 1 is $985. With there is also a fee of getting registration. That's around 125 or 150. That's for the ECFMG registration. But for Step 1, you need to pay around $985. Major portions they will check in the exam is, you can see here, applying the foundational science concept. which is around 60 to 70% of the exam. Rest is diagnosis, like what will be the diagnosis. They give a scenario and then they will ask what is the diagnosis of that. That's only 20 to 25%. But major percent comes from science concept, basic science concept. And this communication and interpersonal skills, that's actually your ethical questions which people get in the exam, and that's the trickiest part. So mainly they are focusing on the ethical portion rather than on the basic pathophysiology or the basic concepts. So try to cover the basic concept wherever, like they should be at your tips, I will say that. And then these are practice based learning and improvement. They are not marked. You will not get any marks on these type of questions. These are just experimental questions, could be related to any of the research or any of the finding, recent advancement in the science or in the medicine. So these are not marked, I will say that. And here you can see the major portion, the discipline they usually test: pathology 50 to 60%, physiology 25 to 35%. So basically your 80% to like 70 to 80% comes from pathophysiology. So this is the major portion they usually test for it, rather than just giving your time to master the genetics, which is just 5 to 9%. Like out of 280 questions, you may get around 3 or 4 questions from the genetics, but most of them will come from pathophysiology, most of them. And then the rest is followed by pharmacology. Usually in the pharmacology, they ask for not the drug name, but rather the mechanism of action of the drug. Let's say common medication given for one of the bacteria is penicillin. So they will not ask you will give penicillin or you will give any other drug. They will ask what will be the mechanism of action of that drug, which is given in that particular case. Let's say for prophylaxis of Neisseria meningii, you give it rifampicin. So what is the mechanism of action of that drug given for the prophylaxis? So these type of the things they ask from the pharmacology, rather than just cramming the drugs. Remember, make sure that you remember the mechanism of action of the drug, and the common adverse effect are not tested. Specific, like there is bupropion is contraindicated in patient who have anorexia nervosa. Why? Because they decrease the threshold for the seizure. So they particularly ask one of the specific side effect of that drug, not going for the common. Just remember the few of the uh, specific side effects of the drugs. Then of course your biochemistry, microbiology, you can see how these portions are tested. After this step one has been passed or failed, I believe you should have a good grip on pathophysiology. Like it is a major portion. If you are able to able to have a good grip on pathophysiology, I will say you are good to go. But of course, you should remember all these principles as well. You should be having a grip on these as well. Grip means like you should have gone through all the concepts all the concepts, all the materials which are provided in the first stage. You have covered these all session as well. But master these, I will say that. What are the resources available currently? First, I will say that use the right resource which works best for you. Some people find it like USML RX is working best for me rather than any other Q banks, such as Kaplan Q banks are there. Some online other Q banks are also there. So try to use those which work best for you. But there are also standard like UWorld, which is everyone should do it, I will say. And then you have NBMEs, which are also practice exams. So you must take NBMEs. First aid is a review book, and then you have Pathoma, and then BNB lectures and BRS. Coming back, what will be the best resource, and when to use these all resources, and how to use these all resources. Now, first aid, everyone say go for first aid, go for first aid. I said this is a review book, and before reviewing a review book, you must have a basic knowledge of that particular subject or the topics. That means like you should have gone through the lectures, like boards and beyonds. Kaplan lectures are also there, but nowadays board and beyonds are really good, and they are very to the point, and they explain really very well, I will say that. So try to have a basic knowledge of that particular topic, And if you have your reference books, people use them during the medical school. If they have it, they should, then they can, directly jump to the first aid if you have a good basic knowledge. But if you don't have any basic knowledge, just say you have a gap for 2 to 3 years, you are doing practice medicine, and then now you said, no, I want to take USMLE exam, but most of the topics are you forgot. So don't jump on first aid. I will say try to have a good grip of your prior knowledge, and you can go through the books, reference books, and then you can, start your first aid. Again, I will emphasize, this is a review book. You must have it, but before starting, you must have the basic concepts of everything. And then the UL, it is a practice. It don't take it as an exam. So don't take it as an exam. Now, if you're securing less percentage, like people say, on every block, I secure only 40%, 60%. My friend is securing 80%. Now that's a difference. Like that person may have a good basic knowledge, and that's why he's securing a higher percentage in the UL, and then you must not have it, that one. That's the reason. Or he must be in advanced level. So don't take it as an exam. Just take it as a review, the like reference or reading material, practicing material. Not take it as an exam. Don't over stress yourself or exhaust yourself with the UL, as nowadays you will have around 4,000 questions, and then people say I have to complete it. Yes, you need to, but remember, UL is a practice exam. It's just used for the practice. And again, USML RX, NBMEs. NBMEs is also a practicing exam which can predict your scores. So try to use it. Now, when to use NBMEs, that's also a question people have in their mind. I recommend people, if they are using the UL as a random mode, let's say if they are going for a random subject wise or random doing random time mode, and at the 10% or 20%, they should start doing the I will say not the recent one, the one which came like 17, 18, or 19. So like 20, 21, 22, these were the time when they were introduced in 2019. So start doing from those, from 2019. If you can use those 19 and 20 NBMEs around 10 to 20%, that's really good. So that in that way, you will be able to keep a track record of your NBMEs. So after every 20% or 10% or 15% of your work, you can take one NBMEs, but keep some NBMEs for the end. Like if some of the NBMEs are now predictive of your exam scores, that will depend on the current. Let's say if this is 2022 and you are taking the exam in 2023, like after a year. So at that time, if there are new NBMEs and they are most predictive, keep that for the end, like keep them for the last rows as a predictor for your exams. USMLRX, I recommend you can use it while you are in your medical schools. If some of them are medical schools, they can use, let's say they have covered anatomy, so they can do the anatomy questions. Let's say if there is a modular system, where first modular system is like they went through cardiology, physiopathology, anatomy, biochemistry, as well as pharmacology. So they can use these resources to have a good grip of the questions. So USMLRX and other QBanks prepare your mind for questions. They are a good source for question practice. And then of course, pathoma is for pathology. Those who they must go. You must once you should go for pathology with the lectures to have a good knowledge of all the concepts. Timeline. Now, that's a really tricky question. Like, what is the best time period, and when should I take it? It's really different. In US, the medical students are supposed to take exam by the end of their second year. They have been given 3 months for dedicated studies to take this exam. Some universities give 3 months, some give them 2 months. So it's really different for IMGs versus American medical graduates. So we cannot compare IMG's study schedule with AMG's because it's totally different. For IMGs, mostly because of their curricular is different, and they have their own timeline. Some of them are those who have graduated, some of them who are still in their medical school. So I'll say sooner is the better. When you say that I will have to take it and then you have gathered all the material, so you should start right away. If they are in the medical school, try to cover those topics which are like covered in your university, so you can go through the reference material of the USMLE. Like you can go through your UWorld for those particular topics, or through the USRX for the question practice. And you can also cover through the BNBs and add those points in your first aid. And if you have graduated, so 6 to 8 months are really good enough for, with if you are even doing nowadays, if you are doing even your job, active job, so even 6 to 8 months are more than enough, because now has been pass or fail. It has totally changed everything, because the time when I was giving it was like scores. So I took around a year to take the exam with the active job. But now it has been pass or fail, so 6 to 8 months are more than enough. Always make a schedule. What that means is like those are the, let's say, biochemistry, pathology, physio. These are the subjects. So you make a schedule when you will cover your biochemistry, when you will cover in this time you have to cover your immunology. So make a schedule. Always make a schedule of your practice materials, everything. You should say like you should make a calendar, and then you should be covering your goals. Always set your daily goals. Daily goals means, let's say you went to university and after that you have to come and you have to give time to your, and you have to give 2 hours, but you have to cover 10 topics. And if you're not able to cover 10 topics in 2 hours, you have to sit. You have to sit and come, and you have to fulfill your goals. Even if you have to take half an hour extra, so you have to fulfill your goals. If you will set goals and you try to fulfill it, then you will feel okay, encouraging and rewarding, and that's what will be increasing your pace on a daily basis. You will increase the pace, and the next coming days you will be able to cover more topics in those 2 hours. Then people usually have when to start UWorld, when to take NBMEs, when to start first aid, and when to take step one exams. So earlier, if you start your UWorld, once you say you have finished all your BNB lectures, you have gone through your first aid, you have gone through all the materials, now you should start your UWorld. Now this was the old practice which you people used to follow. Like they people say Kevlar lectures should be done, you should be done with your first aid, you should be done with your BRS, and then you will start. I will say start with from the very first day, not very first day, well, very first week, I will say, because you covered the topics in your weekdays, and then in weekends you should do your UL from those topics. Earlier is better, because nowadays 4,000 something questions. It will take us, if you give a separate time to UL, it will take ages for you to do that. That's really hard. Even if you do 100 questions every day, it will take around 40 plus days to complete that without even taking a gap. That's really impossible. Not impossible, I will say, but it's really hard for you. So if you keep on doing during your medical school or during your earlier days of studies, that will be really good. It doesn't matter you do 10 questions, 20 questions, or just 5 questions. You are covering it. The day you will see it has been 2%, 3%, 4%, you will really feel happy that you are covering your U-work. And as I already mentioned, what when to do your NBME is, once you have done your 10% or 20% of your NBME or UWorld, you can take your NBME as a practice exam. This will help you track your records. Try to try to save few NBMEs for your, like when you have done all your practice exams, when you are completed with the UWorld, when you have done your first. Try to keep few NBMEs for the end. Those who are highly predictive for that current period. When to start first aid? You can keep your first aid along when you started your UWorld, so that if you find that some points are not there in the first aid, you can jot it down. This question, when to take your step one exams, is really hard. When I was taking my step one, I did all UWSA 1, UWSA 2, and BME 18. At that time was very predictive, but because I took exam in 2019, 21st of March, and on 24th of the March they released new NBMEs. So I was in a dilemma: I should wait for those NBMEs to come, or I should take my exam. Very hard situation. Everybody has their own story. My few of my colleagues, they were saying they had a friend who was in your situation. He just went and he took the exam. He got less score. And I had also another friend who says, "Don't worry, take your exam." So you will find many answers for that. And personally, I followed my gut feeling. I said, "I'm ready. I've done everything. Nothing is left to improve further. I should take my exam." So when you have that gut feeling, even let's say if you feel that you have done 60% of your work, but you have covered most of the things, and now you feel that you are ready, if your gut feeling says that you are ready, then you should go for it. It depends on everyone. Like I have a friend who did UL three times. He wasn't ready at that time, so he didn't. He took it after the fourth time when he did UL because he was not feeling ready. I felt ready when I did my UL once, and with the all wrong, I felt ready. I went for the exam. So it totally depends on how you feel it. That so it's really different story for everyone. What you will need, of course, after the knowledge, you need determination. You should be very determined for your that if you think that my goal is to do residency in United States, you should be determined. You shouldn't be changing it. You should be more precise and accurate. You need a consistency. It's like you studied for 2 months and then now you take a gap. That's not happening. It's not easy. If you lose the pace again, it will take more time to gain that pace. Constant motivation, encouragement, rewarding, you should need it. Now in this, I met a person who said literally four things to me, that there are three persons, if you're married, then four, who really cares for you. One, you yourself. Other one is your parents, and then your spouse. These are the only four-person who care for you. No one else care for you. You need strong motivation from their side. You need strong determination, rewarding from them. Yes, you are doing good. Yes, you are doing good. Keep your hopes high. Don't lose hope between. If you feel that you are getting discouraged, so try to be in a company where you feel encouraged. Don't keep positive people around yourself. Stay away from negativity, because USMLE, I'm not saying step one, but USMLE, whole USMLE pathway is really hard, and you need a constant motivation for this. Thank you. Okay. Any particular questions if anyone have?
Thank you, Dr. Kumar. It was a great compiled presentation. So we have a question asking if you would suggest taking step 2 CK before step 1, now that step 1 has been changed to pass or fail.
Well, that's a really good question, and I also had that question when I started for step one, and I was thinking to take step two before step two CK before I take step one. But you need to remember that I want to go to the first slide. So when you take your step two CK, so they most likely they will say diagnostic and management. Here in the step two, the major portion comes from diagnostic and management and the communication skills. So for a diagnosis, you must know what the disease is and what next you do. So I will say before going for step to CK, you must have some basic knowledge. So foundational concepts are really important to ace in your CK. As step one is pass or fail, no matter what how you study, you pass the exam. That's really good. But for CK, you need all those basic knowledge, because nowadays program will be looking for only step two CK exams, for which is 245. At the average score of the US and Canadian is 245. You can see the difference, like the Canadian and US grad people, their average score was 233 in 2020 for step 1, but their average score for step 2 CK was 245. So they have really good knowledge of this basic, but they have been practicing in the US, so they know what will be the next step. But we come from the international medical graduates, so we don't know what's being practiced over here. So that's really different. So I will suggest you take your step one, because it has been pass or fail, and by that you can grip on your basic concept which you need to apply, and then that's all. that's what will help you in the diagnosing and management portion. So take your step one first and then CK. That's my personal suggestion.
Okay, thank you so for that. So we have also another question. Did you have any predictive assessment that predicted your final score?
Yes, after doing my UWSA one, like I did UWSA one when I did my first round of the U World without doing all wrongs. So after that, when I did all wrongs and went through my first year, I took UWSA two, and then I also took my NBME 18 because in 2019 there was NBME 18, which was highly predictive. So my NBME 18 was the score, like I got 200, 250, and my real exam was 256. So it really depends on the era in which, like if you take it in 2023, you have to look for which NBMEs or which NBME is more predictive or which UWSA is more predictive. You should follow the trend which is going on. Let's say in 2022, let's say if it is NBME 24 or 26, whatever the NBME is that's more predictive, you should keep it for the last.
Okay, that makes sense. So how would you describe the total cost of step one journey?
Step one journey costs you, I will say, if you are doing it after your medical schools, that's really depends on how, if your IMGs, most of IMGs, if they start working, so it costs, it's different for it's like around 900 one approximately 1000 for your step one and $160 for the registration currently. So that's around like $1200. You need 1100 to $1200 for just step one. But it's not just a step one, but it's all the other things. The rest, like you take a time out, you need money support yourself during that time. Some people take classes, some people take tuitions, extra tuition for them. Those who have a little bit weaker than basic concepts. So if you're just asking for the exam, it's just 1200. But I will say it is more than that, which the hidden expenses, which are never counted.
Your on everyone's individual journey, but yeah, commonly you will have an expense to register for the exam. And also, if you're doing your world questions, you'll be buying the question bank. At the same time, you'll be also purchasing NBME exams.
Oh, I totally forgot those.
Yeah.
Yeah, because yeah, that's another expense, which is around U World. If you go for 6 month U World, it's around $450, and somewhere 600 for 1 year. So that's also cost you a lot. So those I told you, like if you they particularly ask for hidden, so these are some of the hidden charges which are sometimes counted, sometimes they not. It depends on person to person. Like if the person is earning a lot and then they don't have any money issue, so they don't count it. If but it should be counted, I will say, because in US medical graduation they are funded for that. The programs funds them, the school funds them for you. They provide them latest edition of the first aid as well. Okay,
Yes.
we have a question from Nihal. I'm
Yes.
sorry if I pronounce your name wrong. How many hours required to review a block of UL completely and properly? So Nihal, if you want my personal experience, when I started after my medical school. So it took me around like for first time, and I was doing, it took me around 3 to 4 hours to revise it completely after 3 to 4 hours. But as I was pacing, it took me around 2 to 3 hours to pace it. So it's roughly, it's depend on how fast you grab it. Some people grab it through, if they are given a questions and they get it right, and then they get the concept from the questions. So and some people are those who needs information in a literally in a detailed paragraphs. So it literally varies from person to person. But let's say if you're a fast learner, so 2 hours to 3 hours are very good enough. So you go through each and every options like A, B, and C, and D or E, and then uh, I will say it takes 3 to 4 hours or more than enough. So for 40 questions to go through. And even there is a few tricks when you are doing your U world. There are a few tricks. If you are doing a random wise, so there is a little trick to do U world. That's what if anyone has U world, they can just open the U world, and when you open the block for revising, you will see total percentage of this question get right and who. So if you just click on the system, once you will click your system, the all question will be arranged in system wise. So in this block you got 4 questions from cardiology, 5 questions from respiratory. So if you do that, that will be helpful in doing doing like you will be able to finish your block quickly.
I think we have another question on which mode to start your routine, random or subject-wise.
That's a really good question. Now the answer is I will say it's not a straightforward answer because Nihal, if can, can you allow Nihal to give a mic?
Yeah, sure. I will unmute her.
So Nihal, I will be
Good
okay.
evening.
Hello, how are you?
Yeah, I'm good. Thank you. Raj. How are you?
So I'm good, thank you. So Nihal, are you in medical school or you have graduated?
I am in medical school. I'm in final year MBBS.
Oh, that's really nice. So you have completed all your basic concepts, right?
Yes.
So for those who are in their medical school in their first year, second year, third year, of course, every university or the school has their own curriculum. If it is a modular system, they need to go through the subject wise. And if it is like first they have to study subjects like I was in a university where I was taught subjects like pathology separately, anatomy separately, biochemistry I was taught separately. So that's really different. And I started after my medical school, so I had all those basic knowledge. I started with the random time mode. So you are also in the same phase, I will say, except for the part of medicine and gynae obs. And I think in step one there are no step one there is no subject like gynae or medicines or surgery separately. So in step one, in the fourth, if you have done completed all of their basics, so I will say random wise is a really good choice to start with. The reason I say it because it will prepare you for the exam as well, because you don't need to go over and over again to practice your speed for the random blocks. Because
Okay.
once you set a block for cardiology, your mind is always prepared the answer should be a cardiology related answer. But when it is
Mm.
random, you will not be, oh, is it is cardiology or is it respiratory, because these two systems overlap sometimes. So it's better to start random wise, which will prepare you for the end. That's again a personal suggestion. It
Yes.
depends
Yes.
on how you are well in those. And when you are doing random wise, I told you if you follow a random wise, there's a little trick. You just click it on the system. So all the question will be arranged by system. If you click on topics, once you click on topics, the all questions will be arranged by the topics. Let's say if you get 2 questions from the same topics, they will be arranged. Or in the same way, if you click the system, they will be arranged like that.
Okay. Thank you, doctor. Thank you so much.
No problem.
Thank you. If I may, I have one more question. If I may.
Sure, go ahead.
Yeah. So I am in my final year currently, and in India, the final year gets pretty hectic and everything. So I am planning for my step one in internship, which is next year. So in the meanwhile, I have around 5 to 6 months. What strategy would you suggest to strengthen my basics and get a good hold over all these subjects? What should I do?
Okay, first of all, you said you are in final year. Once you are done with the final year, there will be 5 to 6 month gap for between your internship and after your graduation from the final year, right?
I didn't get you. No.
So I'm saying you will be having 5 to 6 month between your internship, starting of the internship and your final year exam, right?
Starting of my no, 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 no. It doesn't work. We finish our final year exams
Okay.
and then we start internship. So approximately Feb or March of next year, I'll be having my final year exams,
Okay.
and right after that, if I clear, hopefully, we start our internship.
Okay. So you want to start your USMLE journey in your internship, right?
Yeah, what my plan is, build up all my concepts and everything these few months.
Mm-hmm.
And once I start internship, I'll start UWorld, 5 to 6 months of that. And step one is how I am planning. And I'm asking for your suggestions.
Okay. Okay. So as I told you, like people like you need to. You said you want to make it stronger. I know it's like your final year exams, your U word, and your basic concepts. That's totally. I understand. It's really hectic. People have wards and then duties as well as. So it's really hard. So it's a good
Yes.
idea to have a good concept of your basic knowledge. So take a outdated NBMEs, take NBME, any NBME is like outdated one, and don't take it as a,
Okay.
yeah, just take it as a exam, not exam, just for the practice you took it. And then you
Okay.
can just analyze which questions, which questions belong to which subjects are wrong, and how many questions you got
Mhm.
wrong in that subjects. So you should you should have a good knowledge during this 4 to 5 months. You should work on that, and once you start your U world, you will be able to grab easily. So once you do your basics in these 5 to 6 months, and then you will know which subjects are weaker and which subjects you need to make it work more. So that will really help you before you even start your U work.
Thank you so much, doctor. Thank you.
Because as your question was how much time will be required for to complete a block, so by that time,
Yeah.
like let's say if you get a question from a cardio which is your strong, so you will say, okay, I know this answers and this is the concept, so you will not be spending more time. And but if you don't know which one is your weaker subject and which one is
Mhm.
your stronger subject, you will be giving all equal time, spending more time on the questions which are you already know or you are already strong in it. You're getting my
Yes.
answer?
Yes. 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 I understood.
Like I
Yes.
had a big problem in doing pharmacology, but my rest
Hmm.
was, let's say, let's call it stronger. So what I used to do is I used to give half an hour extra to pharmacology questions, so that I do it very end pharmacology. So when I do all my systems in that subjects in that particular block, then all the pharma question I had to take some extra time, because that was my week. I used to give that. So once you know which one is your weaker subject, you can work on it.
Okay.
So
Thank you, doctor.
meanwhile, when you're preparing and when you're in your final year, so try to have your insight that this is my weaker subject and this is my strong, and then work it, work
Yes.
accordingly.
Yes. Yes.
I just
Understood.
started. Okay, thank you, Heaven. I just started doing UL, but unfortunately, I made the mistake of going over first aid on its own. I was planning to do this step 1 in 2 months. So my question is, does it seem feasible? What you advise and what do you recommend it? I'm currently studying full time. So, Heaven, it's not a mistake that you went just over first aid on its own. You said so you have started UL, but unfortunately, I made a mistake of going over first aid on its own. So you did first aid before doing UL. That's correct, if I'm not getting wrong. So that's not a mistake, I will say. That's not a mistake. You went through first aid. So it's like when you have started your UL, try to keep your first aid with yourself and jot it down. That's not a mistake. And if you have a good knowledge of basic concept and you get the first aid book as a review source, and you are getting it what it has been mentioned, because it is only in points, and you can jot down your points with the basic concept. It will not harm you. So keep doing UL with your first aid. That's the only thing I can suggest, and it's not bad. So keep it up. I will say it's not wrong to do first aid before or you try. That's like how it works for you actually. There is no right method, there is no wrong method. If the method is working for you, that means it's really good, and you think there it will be productive at the end, and it's really productive at the end, that means it's working for you. There is a trend that people usually say, when I was doing, you should go through the Kaplan lectures, then this lectures, then BRS, then that, then first aid, then you are. I did not follow that. As I my story was pretty similar to Nia. Like I did internship, like after medical, I had internship. So first 3 months I had a gap. I completed all the lectures during that time, and then I right away I started with the U word before giving a first aid read. So I gave a first aid read and then started my U word right away. And with the U world, I used to go through my first aid together. So when I was doing U world, I get a question, and when I open my first aid, I remember a whole concept during that time. So I hope I answered your question. So as I already told you, if you do at the speed of 200 questions in like 100 questions per day, that's equal to around, I don't know how much question, but I remember that there are more than 4,000 questions right now in U world. So if you can calculate, if you do a simple math, so 100 questions is equal to around 40 days. So that's what you will require, that dedications. So 100 questions mean you are doing around 2.5 blocks every day. It's like it's doable, not impossible. It's doable, but you need to give full dedication, like studying for around 7 to 8 hours, completing your blog in 2 to 3 hours, giving some time for resting and then doing it. So it's like if you do it at 2 blocks per day, so it will take you 2 months to complete your UWorld. So it's doable. It's not impossible because many of the questions will be repetitions. UWorld is actually giving you how a topic can be tested. Let's say take a topic of SLE or sarcoidosis. So in sarcoidosis, I can literally say you there could be an 15 question I can make you right now. Like what that the angiotensin converting enzyme will be high. What is the mechanism of hypercalcemia? What you will find in the granuloma? What is the best method to diagnose it? What you will do next when the patient comes with the clinical features of sarcoidosis? Why in which descent it is common? What is pathophysiology of sarcoidosis? So the UWorld is similarly in that way. They give you multiple questions for single topics. That's what you need. They tell you to master it. They don't tell you to, you just cram everything. They tell you the basic concept, and they tell you how these questions can be asked. If there is something change in this particular questions, what would have been the answer? So if you are going through your material, think critically, I will say that. Let's say if you're going through particular topic, ask yourself what question examiner can ask from this. In that way, your brain will be working, and you will be very inquisitive. You will think, okay, I have got the concept. Now, what think of the examiner point? What questions could be asked? That will help you to do UWorld and grab your concept more.
Yeah, so whenever we're doing URL questions, we need to also try to have some time spared for doing the explanations. So even if we're able to do 2.5 blocks per day, you should also think of the time to review that question. Because if we don't review those URL questions, it might be just doing the questions and then moving ahead to the next one. We will not be learning from the questions that we already did. So I would advise you to do those blocks, but at the same time review them, especially the incorrect ones, or even if you have some time, doing the correct ones is also good, because you need to know why the rest of the answer choices were not correct. So that can help you to answer the next question when it comes to the main exam.
Yes, I totally agree on that. You must, of course, it's like doing one block for 1 hour, and then you will have to take around 2 to 3 hours, minimum 2 hours to 3 hours to solve it. So that comprises 4 hours in total. People try to skip the good, and the right choice. So if you are in rush, like if you want to finish your UL in 2 months, of course you will go through your all wrong ones, but also go through the ones which were doubtful, like you got it correct but you have still doubt. And then if you think, yeah, I should go for the right one as well, then you should. But if you are having shortage of time, and you are confident enough to leave that, you do not need to review, but just go once, that will be also enough.
We had a great discussion. Thank you so much, Dr. Kumar, for presenting your detailed experience and also providing advice for anyone who needs to take step one at the moment. So if you have any final words.
Okay, I think there is one. Okay, yeah, final words, like it's now step one is being pass or fail. Try to cover the topics, but don't waste more time on those which are not high yields, because there is a difference when it was score based. People try to have knowledge of each and everything, going to using multiple resources, everything. Limit your resources to UWorld, NVMEs for question practice, first aid, and the reference book, and BNB for the lectures. Try to limit those, because as much as you gain, you will be over exhausted. You will be doing more resources rather than gaining. Limit your resources to those which are authentic, such as first aid, UWorld, and RX for the banks. But if you RX for the banks and BNB for the lectures and the concepts, it's pass or fail. It's just an exam. Don't take it as a life or death. So it's an exam, and I wish everyone they should succeed in their life. Thank you.
Thank you so much. Thank you, Dr. Kumar. So for anyone who needs USMLE mentorship, we at Aspiring Mentors provide free USMLE tutorial and mentorship. So you can visit our website at aspiringmentors.com. And thank you so much, everyone,